Hello, Namaskar, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals to speak to you directly from this live show. You can ask your questions and queries, which you've been postponing for a while, and this is a platform where we can bring your questions, place your questions before the experts, and bring an answer for you. Also, on this show, we are going to have a health quiz. You can participate and win prizes from Apollo 24/7. And also, we are giving away discount vouchers and coupons, which you can use on Apollo 24/7, the app, which brings the entire facility of Apollo hospitals to the convenience of your phone. By the way, did I also mention to you that now Apollo 24/7 delivers instant medicines under 19 minutes in many of the cities in India, which can be experienced in Delhi, NCR, Noida, Hyderabad, and as well as other cities. Do let us know in the comments if your city has started the instant medicines as well, and let us know how you want the instant medicine to function in your city as well. So download Apollo 24/7 to experience the benefit of the convenience of Apollo hospitals in your phone. Today we are going to talk about healthy gut. We're going to get you everything about how to keep your gut healthy, what, why, how. And joining us today in this live session is a very senior consultant and expert gastroenterology and hepatology, Dr. Raghu DK from Apollo Hospitals, Jubilee Hills, Hyderabad. With more than 15 years of experience, he can be consulted for IBD, liver diseases, pancreas disorders, acid reflux, hemorrhoids, digestive disorders, acute pancreatitis, etc. And he's having memberships in quite a lot of American board certification in gastroenterology, American board certified in internal medicine, Delaware state medicine license, and also CDS certified, federal DEA certified as well. And here is Dr. Raghu joining us, and you can ask all the questions directly. Hello, Dr. Raghu, welcome.
Thank you. Hello, everyone. Thank you for having me today for the gut guide and all the new things that are happening in the world of the gut and everything. It'll be hopefully a good, exciting 1 hour session.
Yes, yes. It's always wonderful having you on the show because you bring a lot of inputs and insights, and it's very interesting to see your observations. So, gut, healthy gut, and this word excites me so much. I like talking about everything is all about gut feeling. So let's start with this word gut. What is gut? Medical term mein, is there something called gut?
So gut is probably the new buzzword. That's the most trending word all over. I guess, especially since COVID, people have become a little more conscious about their gut because, although previously they used to think it's just a myth, but I think the gut is the entry point for everything in your body. What you put inside is what determines what you are, and what you put inside is what determines what comes out. So the gut, in my view, is one of the most important, or understudied. It's not understudied, but they don't value it as much as they do to the heart. Anything happens to the heart, to the lungs, people just jump to conclusions. When it comes to the gut, you may not see immediate instant results all the time, but you do see some long-term chronic issues with gut, and which can be life-threatening or devastating. So, like you asked, what is the gut? Anything that comes from your opening mouth to the exit anus is the gut, which includes your mouth, your food pipe, which is the esophagus, the stomach, the small intestine, the large intestine, the rectum, and the anus. Everything is your gut, which is aided by certain organs such as the liver, the gallbladder, the pancreas, and all these, which send their secretions into the gut. So all this interplay is called the gut.
Great. So it's not just a small topic that we're going to talk, it's the entire system that we're going to talk. And also, there was something very interesting that I've read and I keep reading. Gut is your brain, it affects your brain, your emotions, your impulses. So it's your second brain. Do you agree to that? And why is it so?
Absolutely. Absolutely. Well, I'm a gastroenterologist. I have to agree to that. But in general, too, it is. The gut is your second brain because there is, the gut is your brain. The gut is your intestines. The brain is what sends the signals to your gut. So there is something called a gut-brain axis, which is a bidirectional axis. So when your brain has distress, it sends the same distress signals to your gut through this gut-brain axis. It is a complex system involving certain nerves, such as the vagus nerve, parasympathetic, some hormones, and the immune system also, as a complex system, consists of the gut-brain axis. So That's the reason why whenever you have certain stressful conditions, such as you're going for an exam, you're traveling, you have an upcoming stressful event coming up, your gut seems to act up. At the same time, when you have an upset gut, when you have the runs, you have the loosies, you have the diarrhea, or you have constipation, you haven't had a bowel movement in a few days, you're extremely bloated, you're very irritable, you tend to have a lot of mood swings, you tend to feel a little anxious, you feel a little socially, you don't feel, you feel awkward. So that again goes on to tell you that the gut and the brain are interconnected through this complex system called the gut-brain axis, and it's very important to understand that that's the reason why the gut becomes the second brain after the brain, which is interconnected to the gut.
Very well explained, Dr. Raghu. Very simply put there. But also, while we talk about the health, the healthy gut, there's something that is taken up the internet by storm, which is inflammation. The inflamed gut. The actor Vidya Balan's recent statement has gone so viral that she's cured her inflammation of the gut and thereby she's lost weight. Let's take a moment here to understand the inflammation, the obesity, and the connection with the healthy gut.
Yeah, I heard about that statement that she made, the popular actress Vidya Balan, where she talks about how inflammation and the interplay between inflammation and weight gain and bloating and mood swings and all that, which to an extent is true. Actually, to the most part, is true because it brings to the forefront an important aspect called inflammation of the body. Inflammation is nothing but the body's response to an injury or any infection or any insult that happens to the body. So this inflammation can lead to a lot of metabolic dysfunction, can lead to a lot of digestive issues because end of the day, it's your gut which is absorbing most of your nutrients, absorbing your proteins, your water, your fluids, your fats, your carbohydrates, everything. So when this gut is affected through chronic inflammatory conditions, such as infections or any injuries to or insults to your gut, this digestive process, the metabolic function, everything takes a beating, takes a hit. So when that happens, you tend to have a change in a lot of digestive functions. So, when this digestive function is affected, your hormones also come into play. A lot of your hunger hormones, such as the leptins, are affected. The gut also is one of the biggest immune system in your body. So when your immune system is affected by this inflammatory process of your gut, so a lot of the absorptive processes of the intestines are also affected. So long-standing inflammation can lead to damage to the gut bacteria, which is dysbiosis is a condition which I need to put forward over here, which is nothing but alteration in your gut microbiome. The composition of your gut bacteria or flora or microbiome is altered. It creates havoc in your intestine. So as a result of which, there are certain bacteria that help with fat absorption. They also control the calories that are absorbed from your intestine. So when these bacteria are altered through all these inflammatory processes, then the amount of calories that are absorbed changes. Certain bacteria are adept in absorbing fats. So this leads to insulin resistance, as a result of which weight gain. So again, inflammation leading to gut bacteria alteration or dysbiosis, leading to alteration in the amount of calories and the source of the calories that are absorbed, and also where these calories are absorbed and how they're disposed into your body also is affected. So it is an interplay of all these things. I would assume that's what Vidya Balan was mentioning to when she was talking about inflammation and weight gain and
Wonderfully. Yes. So, can I ask you one interesting question from your line? You did mention, right, just before you started explaining what the inflammation is, the insults that we continue to put our gut through. What is, in your term, insult? Is it food? Is it eating too much? Wrong food? What is it?
So the insults could be from various reasons. It could be your lifestyle, it could be your diet, it could be your stress levels, it could be your social activities, whatever it is. The medications you take, prolonged antibiotic usage. We see a lot of people, they have these sniffs and the colds and everything, they pop in an antibiotic. They have a bellyache, they eat outside food and they have some loose bowel movements for a day, they pop in antibiotics. So what it does, it changes your gut bacteria. Like I told you, the gut is your one of the biggest immune systems in your body. So all the good bacteria are gone. So when I talk about bacteria, people only think that bacteria are harmful, bacteria are bad. No, it's not the case all the time. Your gut has millions of good bacteria inside, and we all need these bacteria on a day-to-day basis for our daily routine functioning. So without these
Correct.
bacteria, all these systems are affected. So these people who pop in antibiotics, who take in all these medications for whatever reason, they tend to have altered gut bacteria. Another thing, eating a lot of processed foods, eating all these sugary foods, taking a lot of caffeine, alcoholic beverages that you take, all these fried fatty foods, excessively spicy foods and the oily foods, the carbonated beverages that you take, the artificial sweeteners that you take, the sorbitol, the sugary alcohols, and all these tend to cause alteration in the gut bacteria, leading or creating havoc inside your system. This is what I mean by the inflammatory process from a combination of all these. Not getting enough sleep at night can be one simple thing that can alter your gut bacteria. Not hydrating yourself well, not drinking enough water. So have a good, everyone says, how much is the amount of water I need to drink? You can't individualize the amount of water you drink. Someone who's working hard in the sun all day, their water requirements may not be equal to someone who works inside an air-conditioned room all day. Someone who does a lot of physical labor work will need a little more water because you lose a lot of water through your sweating. But it's not the same someone who does a stationary desk job. So you tailor it to amount of water you think you're requiring through the day. At the same time, sleep. How much is the adequate amount of sleep? Yes, I mean, if you go by the norms, 7 to 9 hours of adequate sleep every night is the requirement. But can you get that every day? Maybe not. But when you don't get it, try to make it up in the next few days where you target your 7 to 9 hours of sleep, make it up to the most point you can. Get a good lifestyle, exercise on a regular basis. Exercising, not only does it help digestion processes, it also helps restore your gut bacteria also. So get a
Yeah.
good your food should contain, I tell all my patients, don't eat a single colored food. Have multiple colors in your food. Have a good set of whole grains in your food. Avoid the processed foods. Eat a mix of green leafy vegetables with salads and fruits, and add colors to your food. That probably, I'm not saying the food colors, but add color from natural sources.
All that you've been saying is making sense, and it's actually reflecting me what I should be doing, because I've been off track and I haven't been sleeping well. I'm stressed. I'm doing a lot of things that I shouldn't be doing. So thanks for holding up the mirror. I think this episode was designed for me today. But yes, while you say that we should be eating a lot of colored foods, when I started to implement the color therapy on my plate, I found that I started to kind of have digestive issues. Is sudden intake of fiber, or adding a lot of greens, is also something that sets you on a wrong tone, or do I need to gradually start?
Yes, you brought up a very good point. So when I meant that adding colors to your diet, I didn't mean add the rainbow colors to your diet all day and start from day one and eat everything from day one. I think gradually you start eating foods to a point where, yes, you've exposed your body gradually over a period of few days to weeks to the different food items, raw food items. Then if you feel the need to alter some of these, you feel bloated, if you feel that your digestive system is not feeling well, start regulating the foods that you eat. Maintain a food diary and see which ones are your trigger foods out of these. Start by eliminating one at a time and see which one of those, once you eliminate, has caused reduction of your symptoms and you feel much better after you eliminated certain foods. I would say that's the best way to target which foods you could be allergic to or you could be intolerant to. So when I said food colors, I not eat them 24/7 all day every day, but yes, once you introduce them gradually, if you feel the need that you're not feeling your best, start eliminating one at a time and find the trigger target food that could be causing your symptoms.
Yes, and raw food is one such target that I did understand that I wasn't doing really very well when I was eating something which is uncooked. Is that a case that it's difficult to digest raw food? Or
The fibers in the raw food sometimes can be difficult to digest. So if raw foods are not for you, you can have semi-cooked or boiled vegetables. So boiled foods should be your next target. Again, the same thing goes with raw milk. raw unpasteurized milk can harbor a lot of bacteria. Salmonellas, the listerias, and all these can come from the raw unpasteurized milk. So boiling the milk, or some people who have lactose intolerance look for lactose-free options, or plant-based milk options, or plant-based protein options. Or you could use other sources of protein, not just from the milk. The gluten sensitivity is another thing that we see in a lot of patients. Gluten being the wheat, the rye, the oats, and the barley. If you're sensitive to these, the best way to do is by maintaining a food diary. Find your trigger foods. Avoid your trigger foods. That's the best simple solution that you could have.
Thank you for the advice there. So Priyam Chatterjee and Dhanu, I'm going to take your questions in a very, very short while. Just before I take the audience's question, one quick question. You did mention about the antibiotic abuse. Now that the antibiotic usage is rampant all over the counter, and so much of availability, who should take antibiotics? And on, I know that it's a prescription drug, but people are buying them left, right, center. Any advice and warning from you?
Well, that's the difference between our setup and the Western setup, I guess. The availability of antibiotics in India is so widespread. Most of the times you don't even need an antibiotic. You go to the pharmacy and then you ask the guys, I have a belly pain, I have a fever, I have a headache. There you go, boom, you get an antibiotic. I mean, the pharmacist also, I'm not saying it's the pharmacist, the guy who works at the pharmacy, you're going to get better in a day. And that's what the patient wants. I want to get better in a few hours or a day, but you don't look at the long-term side effects of these. There is something called antibiotic resistance. You use antibiotic for the first time. Yes, it may work on the gut or the bacteria that it's intended to. But the next time you get the same infection, and a resistance to that antibiotics is only going to mean that you're going to require a stronger antibiotics. And where is this going to stop? It's going to come to a point you're going to have a resistant set of bacteria inside your system, and it's going to cause devastating effects. So the injudicious use of antibiotics should be stopped. When do you need antibiotics? Yes, when you've tried the regular methods or the home remedies or the regular over-the-counter non-antibiotics, the non-prescription approved medications that you've used, and you have not noticed any significant improvement in your symptoms. You've noticed worsening of your symptoms. You've noticed alleviation of your symptoms. That's when you need to consult a healthcare provider, your family physician or your consultant or your specialist physician, to find the specific drug after finding out the specific culture sensitivity of the bug that they're intending to treat. That's the right approach to treat whatever infection that you have, rather than throwing the kitchen sink at whatever infection you have and looking for a response. And the next time the kitchen sink's not going to work. You're going to need something stronger than that.
Yes, Dr. Raghu. And on the contrary, people, while they think that antibiotics are beneficial to kill the wrong bacteria, pre and probiotics are beneficial to improve the good gut bacteria, and thereby will it help if I go and buy a lot of pre or probiotics which are available and start popping in? Is that going to help me to improve the good gut bacteria?
Now, before we do this, we need to know what prebiotics are, what probiotics are. Probiotics are nothing but a set of live bacteria or the yeast that we give to the body, or that is inside our body, that helps in the digestive process, the metabolic function, and the overall well-being of the body. And it forms a principal part of our gut. And those are the probiotics. You can get it in the natural foods that we eat. The yogurt, the common yogurt, the curd, the perugu that we eat, that's the natural probiotic. There are other natural probiotic sources also, such as the kefir, the kombucha, the sauerkraut, the kimchi, and all these are the natural probiotics. And I'm a big proponent of using probiotics on a regular basis. They tend to help you. Having one single type of probiotic is not the way to go. You need to have a diverse set of probiotics in your body. So that's the reason why I tell people, don't just stick to one set of food. Try foods from different sources, different raw vegetables, raw fruits, or different sources have different cuisines from different cultures, because everyone has their own source of probiotics in them. So your diverse set of bacteria in your gut helps in the digestive process. So that's what probiotics are.
Okay.
There are some prescription strength probiotics that have a higher dosage of the probiotics. You see the millions, the billions of the spores and everything, they have a higher strength of the probiotics. That helps. Having a wider array of probiotics, that also helps. Now, coming to prebiotics, what are prebiotics? These are nothing but the foods or the feed that you give to the probiotics, which are the live bacteria and yeast. Where do you get these natural prebiotics? You get it in the raw foods that you eat, the garlics, the onions, the bananas, the oats, and the leeks, and all these. These are the prebiotics. You're feeding these bacteria to grow on their own. That's the reason why I tell you having these natural foods is one way of avoiding prescription strength medications or antibiotics. You're using natural means of controlling your gut bacteria. So that is what prebiotics and probiotics. And are they for everyone? Well, it all comes down to your lifestyle. If you are someone who eats a regular, healthy meal every day, nutritious meal every day, who gets a good amount of sleep, levels are low.
Okay,
You do not
yeah, we
do
lost
a
you
lot
for.
of.
Please do continue. So
So
if somebody who's really very healthy and then not healthy, that's the difference you were explaining. Please do continue.
So if you're someone who maintains a good healthy lifestyle, who eats healthy, who sleeps healthy, who exercises on a regular basis, your stress levels are controlled, then you don't need any of these prebiotics and the probiotics. You're doing everything that's required by the book. For someone, who is that perfect person? Not everyone is that perfect person. So if you're not, that's when you need to incorporate these prescription strength or the natural prebiotics and probiotics into your diet. Like I said, if you are someone who has a lifestyle which is a stressful lifestyle, you don't get enough sleep, you can't exercise on a regular basis, you can't have 3 meals in a day because you're in a rush all the time, sometimes have to eat meals on the go, and you have some processed foods and artificial sweeteners, sugars into your diet, then that's when you need to incorporate these prebiotics and probiotics into your diet.
Great. So let me quickly ask questions from our audience who have joined us live today. First to go is Prem Chatterjee. Good morning, doctor. We hear a lot of detox programs for the gut which are available online. Are these effective? So let's spend some time on quote unquote detox.
So detox is another big buzzword or a trending word that they use all the time. And now there are so many e-commerce things that come up saying we're going to detox your gut, we need to cleanse your gut and everything. Our body is a machine. Like how any vehicle is, any machine, any engine is, our body is a machine who's trained to what you eat. Your body is trained, or it's actually made in such a way by God that it knows how to digest it. It knows how to, your mouth knows how to chew it. Your stomach knows how to ruminate and break down the foods. Your small intestine knows how to absorb the nutrients. So your large intestine knows how to absorb the water, and your rectum or the anus knows how to excrete. So that's how a machine works. So when you do that, you don't really need a detox. Detox in general was started off for someone who has alcohol dependence or drug dependence. That's the toxin you're removing from your body. We're assuming you're not putting toxins into your body, so you don't really need a detox. Detox, when it comes to, was started off for your liver detox for someone who drinks a lot of alcohol or takes a lot of medications that could impact your liver. Kidney detox for some people who takes a lot of heavy metals or in your medications, because they can impact your kidneys. So those are some of the things that where you may need detox. Intestinal detox is not something required, but a lot of people do use these colon cleansers and the gut detox and everything. Not sure how much it benefits you. Sometimes it may actually have some side effects. You can have persistent, with these colon detox and the enemas and everything, you can have persistent diarrheas. Your gut bacteria is all altered. What your innate gut bacteria has been removed from your body, and then you're gonna be left with a clean slate where you're gonna start introducing new bacteria into your system. All these enemas and everything can have some perforations or gut holes in your gut and everything. So these detoxification things, yes, may help or benefit a few, but in general, they're not required on a regular basis if you follow some of the principles that I mentioned before. Maintain a good lifestyle, eat right, get the good protein sources, good probiotics and prebiotics into your system. You may not need any of these.
Wonderful. So it's a healthy practice that you need to induce and follow. Wonderful. Here's Danu's question. I think Danu has asked a question which is pertinent for many of Indians or younger population as well. Good morning, doctor. Hi. From the last 6 or 7 months, I've been burping so frequently. It's like continuously 6 to 8 burps for every 15 minutes, even if I'm in an idle state. If I'm busy with work or occupied with something, I don't burp as much. So what is this? Is this a reaction when you're working, you're distracted and he doesn't burp? Or is there something
So
with work
burping
and
would
not?
be, yes, it's a very good question. It's one of the most common things that I get asked for, or more than half the patients who come to my practice, or in general, in day-to-day life, ask this question. Burping is nothing but the air that is trapped inside your gut or your stomach or your intestines is being expelled out. Some people, they expel it from above. Some people, they expel it from below, which is called flatulence. So when there's excess air that's being produced inside your gut, it has to come out. So we need to target why this excess air is being produced inside. Some people eat their food without chewing it. They just rapidly gulp their food. That produces a lot of these producing, gases produced inside your system. Some people talk while they're eating, not concentrating on their eating process. That can produce a lot. It's called aerophagia. You swallow a lot of air. Chewing a lot of gum can also, chewing gum can also, you can swallow a lot of air when that happens. There are certain people who produce a lot more gas because of food intolerances. Lactose intolerance is one such condition where you're intolerant to dairy products. When you drink a lot of milk products, that when you have the enzyme deficiency of lactase enzyme, which is the enzyme that digests the lactose, which is a sugar in the milk, the lactose goes through your body without getting digested. That's when a lot of air is being produced and gets trapped. It has to exit somewhere. If it doesn't exit, you feel bloated and full and bloated all the time. You feel like I feel like I'm 9 months pregnant all the time. That's what a lot of people tell me. So that air has to exit somewhere. Fructose intolerance. Some people tend to have fructose intolerance, which is a sugar in the
Seriously,
fruits.
fructose? Oh, this is like people
Please,
do have
just
fructose
like
intolerance.
yes, just like lactose, which is a sugar in the milk, fructose is a sugar in the fruit. It just goes undiagnosed. People say, I only eat fruits every day. I eat such a healthy lifestyle. Maybe you're intolerant to the fructose. Gluten intolerance, which is the ones that I mentioned before, wheat, rye, oats, and barley. So when you have gluten products and you're intolerant to it or you're allergic to it, your body cannot absorb the gluten. What happens to that gluten? It goes through you, gets undigested, and it gets trapped. It has to exit. When you have severe diarrhea, for whatever reason, or severe constipation issues. When you have constipation, the stool gets trapped inside you. The stool produces bacteria. The bacteria produces the
Right.
methane, the gas. That gas has to exit you. So it's not just one stop fix. Having an ulcer in your stomach, having H. pylori bacteria in your stomach, having a lot of acid reflux, all these can be. There's another condition called SIBO, which we talk to a lot of our patients who come to the clinic. Small intestinal bacterial overgrowth. Why does this happen? When your intestinal motility is altered because the food that you're putting inside you, or certain medications that you're taking, or certain medical conditions that you have. A lot of people take pain medications for other medical conditions. What that does, it takes away the pain by slowing down the neuroreceptors, the nerve receptors. But as a side effect, as a consequence, it also slows down the digestive process. It slows down your intestines. When that happens, the food gets trapped inside your gut, and all the air, excess air is produced. The air gets trapped. That's when you burp out all the air. So it's not just a one simple thing, burping out air. It's a mix of all these multiple different causes that can cause the air trap. When just simple air trap, you can treat with certain medications. But when it comes to a point where you have certain alarm features, which I'm sure we'll talk about in the next few questions,
Yes,
that's when
yes.
you need to be alarmed, get some expert help, get tested, and make sure it's not something serious before you go just about using those over-the-counter medications.
Great. So I also know people who go around with all these pachak goli, the candies which are the digestive aids, which are more popular in the name of Hajmola or any of these Digene, Gelisil. Do they really help in digestion process?
Yes, to the most part they do. I should not trash them saying you should not use them. Yes, these are all old mom's remedies, grandmother's remedies that we use at home from my childhood. Yes, quite a few of them work. But they should not become a habit. They relieve gas by, countering the gas. The small bubbles, what they do, they mix all the fenugreek seeds or the fennel seeds and all these, the somf that we eat, the traditional, the pan that we eat on a regular basis also has some, it does has some truth to it. They do help in the digestive process. They help relieve some of the gas, bloating, relieve constipation, bloating, and everything. But they should become a habit where you're having to pop in every day, morning, afternoon, and night, to the point that that becomes like a medicine to you. When it comes to that point, then I would say I would recommend not doing it on a regular basis. Once in a while, as an aid to digestion, when you have a heavy meal, when you have excessive fried fatty food, where you have a lot of oily meals, spicy food, and all these things, yes, those times
Yeah.
I would say once in a while is okay, but not on a regular basis, 2 to 3 times a day for ages together. No.
Yeah, there's a cousin of mine who would want to have a big, full family pack of biryani and a 2 liter soda can after the biryani. So that's what he thinks is relieved of.
I
So,
agree. Great combination. I love it too when I do that. But when you're doing it probably once every few weeks or months, it's okay. Not the 2 liter soda bottle, but having a sip of the Coke or the Diet Coke. I mean, it's sometimes it's so satiating.
yeah,
But
it's
not on a regular.
moderation that you're warning us.
Absolutely, absolutely. Those are small pleasures in life. I mean, not saying you should not do those. Simple pleasures in life. Yes.
Correct. As long as you are doing everything else right, and this is just a small deviation in your track, that's good. And that shouldn't be the main track, and you don't follow the other healthy parameters that you just mentioned. Here's the next question. Ravindran, how do I avoid brain being disturbed by the gut imbalance? You've been talking about, like, it can affect your brain. So how do I control my brain? Is his question.
Yeah, you control. Like I said, the gut is your second brain. So you want to control your first brain. You treat your second brain well. So how do you control your second brain well? Feed it the right things. Do the right things
Yeah.
that your gut would agree with. Give it enough sleep. Give it enough time to digest the food that you eat. Give it enough hydration. Don't give it toxic substances, eating too much processed food, eating a lot of sugary food, and eating a lot of spicy, oily, fried, fatty food, taking a lot of artificial sweeteners, exercise on a regular basis. Give the gut bacteria what they want, what they're craving for. Give them the good prebiotics that they want. Eat the natural the onions, the garlics, and the bananas, and the fruits, and the vegetables. That's how you give your gut or your second brain the right things. Feed it the right things so that your first brain is happy and everything is in harmony. Your gut brain axis is satisfied. It's not coming into play, and everything is fine. Everything is going
Yeah.
as per plan.
That's it. That's it. You keep your gut healthy, and thereby your brain is healthy. That's it. As simple as that. But here's Mahita's question, which is also very, very important. Mahita is a female, and she says that I find that my gut is in imbalance during my menstruation. I have bloating, diarrhea, and why is this happening? How do I correct it? Is there an established connection between the menstruation and gut imbalance?
Yes, to some degree, menstruation can affect your gut motility because of the hormonal imbalance. It can also affect your mood because of the menstruation affecting your gut affecting your brain. It can cause
Okay.
mood swings. So, serotonin, which is one of the neurotransmitters, most of it, 90% of it, is secreted in your gut. It can be a mood stabilizer. It can affect your mood. It can affect your depression, anxiety levels, and everything. So, as a result of your menstrual cramps and everything, your the serotonin levels also can be impacted. That causes the mood swings in a lot of people. Not always does this menstrual irregularity cause it, because there are some pathological conditions such as endometriosis, certain pelvic inflammatory diseases that can affect the female reproductive system, which can also indirectly impact your mood, or they can cause excessive menstrual bleeding, severe menstrual cramps in your gut, inside your abdomen, which in turn can affect your gut motility as a result of hormonal imbalance. When this gut motility is affected, some people tend to have diarrhea, some people tend to have constipation, some have pain, where we dwell into the realm of IBS, which is irritable bowel syndrome. So irritable bowel syndrome and menstrual irregularities go hand in hand most of the time. So IBS is a complex condition, just like how GERD bloating is. IBS also is a very complex and common condition which has either diarrhea or bloating or constipation or pain. But unfortunately, the most common type of IBS is the mixed type, which is combination of all those four different things that I mentioned: the diarrhea, pain, constipation, bloating, and everything.
How can we
So,
help women who face this?
So, yes, so find a reason why you're having this excessive menstrual cramps. Is it a simple menstrual cramp that you're having? Is there any other gynecological issue that you have which is causing you to have these repeated attacks and insults over extended period of times? Having it at the first or second day of your menstrual cycle, having these excessive cramps is one thing. If you have it all 5 days and few days before and after your menstrual cycle, may be a pathological condition where you need to seek some expert help. So at these times, having some things to calm your gut, having some ginger based or having some mint based, peppermint based teas, having some herbal teas which contain these, having some chamomile infused teas, and all these can soothe your gut to an extent, also relieving some of the symptoms that you have, using some antispasmodics, because like I said, a lot of neurotransmitters are secreted inside your gut, the serotonin and everything. Using medications to control these neurotransmitters, having antispasmodic medications that can target these neurotransmitters are some of the medications that you can use when you have these symptoms.
Great, thank you so much. That's wonderful seeing a gastroenterologist and a hepatologist talking about chamomile tea, tulsi tea, or the mint tea. It really feels good. Thank you. So the next question is from Ruchika. Ruchika is asking two questions. She suffers frequently from bloating, gastric episodes, headaches. While I've started to eat healthier and timely, I do miss at times because of busy schedule and best approach for it. Also, there are people who say eat in intervals of 2 hours, and there are some others who advise fasting or intermittent fasting or skipping the meal. Can you also advise what is good? Simultaneously, I would want to take Vamsi Nalamali's question, which is also similar. He has continuous burping full day without eating. You know, if he goes without eating also, he's bloating. So Ruchika is also asking the same question, that she's not eating and she has bloating.
So basically, every one of them is asking, what is the perfect diet for me? So there is no
Yes.
one specific diet, that it's not a one size fits all for everyone. Everyone has their own stress levels, everyone has their own social life, everyone has their own lifestyle, everyone's work schedule is different, your age is different, your medical health conditions are different, everyone's diet requirements are different, culture differences, and everyone's eating patterns are different. If you are someone who is trying to lose weight, have a calorie restricted diet, have a diet low in carbohydrates, some people, they use keto as a protein rich diet. That should be your diet of choice. Someone who has lactose intolerance, that could be the limiting factor. And then find the trigger lactose item that you're eating in your diet, restrict that lactose in your diet. Someone who's gluten intolerant, that's something you need to restrict in your diet. Find out what it is that you're eating, find that trigger item that's you're eating that could be causing you these symptoms, and take it away. That's the simple fix for it. When you did all that stuff, you maintained that food diary, trigger foods you've done, then it probably wasn't that's causing you that bloating. Then something in your lifestyle, you're fasting to extreme period of time. Extreme fasting also sometimes can create havoc in your intestines. There's acid being produced in your intestines. It's being released always into your small intestine, in your stomach. You're not feeding the acid something that could cause or help you with these symptoms. And yes, that acid is going to create havoc. You're going to have reflux, you can have burning sensation in your abdomen and your small intestine. You can have malabsorption because of the excess acid production. So the prolonged excessive fasting also, some people I see do 16, 18, 20 hours of fasting. I would recommend against it because of the reasons that I mentioned above. And the other question that was asked was, I travel, my food habits are not the best.
Timings.
Yeah. So when you do that, carry some probiotics. It's not that it's the same probiotic that works. Find the good probiotics or the best probiotic that works for you. Because probiotics, there's this fad that some people say probiotics are used for weight loss, used to lean myself up. Probiotics are used for reflux and everything. There is no one set of probiotics that works for everyone. You need to experiment with the probiotics, find which probiotics works for you, and find what you're using those probiotics for. And then, because there are several strains of probiotics, and in several of these medications that come out in the natural or the prescriptions with probiotics, find which probiotic works for you. Find a set of probiotics, carry them with you whenever you're traveling. Have a good set of probiotics whenever you take a diversion from these foods that you're eating which you're not supposed to. Incorporate these antacids or the probiotics into your diet, and that should help you with most of your symptoms.
Great. Thank you so much for that answer there. And here's Venkatesh who's asking, is there a permanent solution to ataxia and SCA? I'm not sure what that is.
Ataxia is a neurological condition which I would like to know what ACA means. Ataxia is a neurological condition which I'm not sure if we're talking about the gut-brain axis. I don't think there's much interplay between ataxia and your gut. You should look at your neurological condition, consult an expert neurologist to find the reason why you have ataxia.
Great. So, I don't think that we can discuss about it here. As such, I'm running short because I would have loved to talk about H. pylori, SIBO, the intermittent fasting, and a lot of other things, IBS, IBD. I would have loved to talk here, but as such, I'm running short of time. So, let me continue with the other questions. Ramya Nagaraj is asking a very interesting question. How long can I take PAN or Razo? These why? And how long can one take safely?
So again, I'm going to frame that question again back to the same person. Why are you using this PAN and Razo?
Yes.
Are you using it for heartburn? Are you using it for abdominal burning sensation? Are you using it for bloating? What is the reason why you're using it? Are you using it as a prescription for some medical condition that you have? Or are you using it on a regular basis just because you don't want to have the acidity and reflux preemptively? So there is every different condition has its own duration of antacids that you should be using. If you're using it just for the simple run-in-the-mill acid reflux or the gas and the bloating, you should not be using it for more than a week or 10 days because that's the intended usage for it. If you're using it for esophagitis or reflux, gastroesophageal reflux disease, you should be using it a prescribed strength for a prescribed amount of time, about 4 to 6 weeks, and then stop it. If you're using it for a gastric ulcer, or if you're using it for H. pylori infection, the duration differs. If you're using it for acid secreting condition inside your body, which is a pathological condition, prolonged duration of antacid and strength of the antacid also should be used. So again, it's a
question not to be answered today. Yes. So here, let me continue with the other questions. Mahendra Chaudhary and Mr. Krishna Kitur, let me take your questions in a while, but let me continue with Lakshmi Gopal and Nirmal Babu's question. Lakshmi Gopal is asking, does boiled egg, 4 to 6 of boiled eggs a week, cause gut problems? Can egg be added to diet as protein? That's number one. Nirmal is also asking about eggs. Which is the high protein food to be taken regularly in an event? I'm not eating eggs or non-veg items. In elderly, how do I maintain normal activities? So let's talk about protein.
So protein is a part of your mixed balanced diet that you eat every day. Just eating protein rich diet probably may not be the way to go. You need a good combination of carbs, proteins, fiber, and the fats inside your body, because every one of those has their own function inside you. So adding what are your protein sources is one of the questions. Yes, protein sources. Eggs are an excellent source of protein. I eat eggs myself and I love eggs. So eggs are an excellent source of protein, but anything in excess is not good. Anything in moderation is an excellent source of nutrients to your body. There are people who eat 1 or 2 eggs a day, they get away. Some people who eat 4 to 6 eggs a day also, as long as you're watching your calories. It also depends on what else are you eating along with these eggs. So I eat 10 eggs, a dozen eggs a day, but what else are you eating along with these? And how much of the eggs are you eating? Just the egg whites, or are you eating the egg yolk, and which can sometimes add excess calories to your diet also. So are you eating a diet rich in a lot of processed food along with these eggs? May not be that beneficial if you're doing that. So eggs is an excellent source of protein if that's what you're looking for, especially for the people who are looking to incorporate more protein into your diet. And for the vegetarian...
Yeah, but Lakshmi's question is, can it cause gut problems? Can it cause digestive issues?
So the egg protein in some patients, just like how the protein in milk, protein in some in like just like how gluten can be whey protein, some people can be intolerant to it. So some guts may be intolerant to the protein in eggs. Well, in that case, you need to watch out the amount of protein that you give your body or expose your body from eggs. So 1 or 2 eggs a day may not be as bad as when you compare it to having 4 to 6 eggs a day, because when you overload the body with egg protein beyond a certain limit, you can have some effects from it. So try to experiment by using 1 or 2 eggs a day and then increase it. If you do not have any issues with the egg protein, I would say go for it.
Great. So this is Nirmal's question, who says that they can't eat non-veg, they can't eat eggs, but then for seniors to avoid muscle loss, what's the best protein?
So with aging, it is a common thing that you do tend to lose muscle weight, muscle loss, unless you continue to do weight training on a regular basis. Even though people say I'm 40, I'm 50, I'm 60, this is not my age to do weight training. Everything. No, I don't think that's the right thing. There is no specific age limit when you need to stop doing weight training. When you do that, is your muscle is getting what it needs, and the protein is only going to keep going into your muscle as long as you keep doing the weight training. And how do you keep getting the protein sources? Whey protein is a good source of protein. Where in someone who wants to get protein, the sprouts is a good protein source. Soya, paneer, and all these are also natural protein sources. Milk also is a good source of protein in patients. All the nuts, the whole grains also can be decent source of protein in patients who do not eat eggs or
Eat
meat.
non. Yes. So last 3 to 4 minutes left, and I have 2 more questions to go. Mahindra Chowdhury is asking, can you please suggest a safe laxative for a senior citizen having issues with constipation?
Well, that brings us to that very broad topic of constipation. Again, there
Yes.
is, like I said about the diet, no one size fits all diet. There is no one size fits all laxative for someone who has constipation. We need to target the reason why you have constipation. It's a topic by itself, where what
Correct.
is causing you to be constipated? Are you taking any medications that are causing you to be constipated? Are you not drinking?
Okay, so I think we've lost the connection. Dr. Raghu's end. Mr. Krishna Kittur, we'll be taking your question next once Dr. Raghu joins us back. It's good to see you back on this live session. It's been a while that you haven't asked a question on the show. I hope you're keeping very well, Mr. Krishna Kittur. And yes, Dr. Raghu is trying to join us. The next question that I would want to take is Mr. Krishna's, who's asking about fatty liver. Yeah, these are the questions which bring us to larger discussions. Yes, Dr. Raghu is back. So I
So
know that I just 3 more minutes to go. Constipation and fatty liver. Next 2 questions are going to demand 1 hour each. Yeah,
so
quick
like I said,
answers.
we need to find out the reason why you're constipated first. Once we know that the reason for your constipation, either increase your water intake, increase your fiber intake, increase your physical activity, check your thyroid, treat it, take away the medications that could be causing you to be constipated, consult an expert physician to see if there is anything inside your intestine. You have a blockage in your intestine, like a colon cancer or something. You have inflammatory bowel disease that could be causing you to be constipated. If you have any adhesions or scar tissue in your intestine that could be preventing the stool from coming out. Once that has been ruled out, then you come into the realm of medications. Several medications, such as bulk forming medications. You have medications such as the isabgol, which could be a natural, the psyllium husks, which gives you enough bulk and fiber into your food and your stool. Next, you have the stimulant laxative, which increases the motility of your intestine. You have the osmotic laxatives, which increases the bulk in your stool and helps have a good bowel movement. You have the prokinetic agents, which increase the motility and also increase the water content in your stool. So it all, you have to individualize these medications depending on the reason for your constipation, rather than saying this one laxative works
Just
for
pick
everyone.
one. Absolutely. So Mr. Krishna Kittur is 75 and his diabetes and hypertension are under control. He's 75-year-old. But in last 2 years, he's added girth around the abdomen and 6 kgs weight that he has put on. He has NAFL and fatty liver. What else can I do? He's taking the tablet.
So again, since we're talking about the gut, find out if that is the cause. Fatty liver has 1,000 different causes. Your lifestyle can be, if you have diabetes, high blood pressure, cholesterol, if you have a sedentary lifestyle, is that causing your fatty liver? How is your alcohol consumption? Do you have any viruses that could be causing you to have fatty liver? Are you morbidly obese or obese that could be causing you fatty liver? What is causing your fatty liver? When it comes to the gut, since that's the topic of the hour, find out what is causing you to, is your gut the reason for your fatty liver? Like we discussed the same thing about how we started off saying Vidya Balan, her quote saying inflammation. Yes, you gut inflammation also because your immune system is in your gut, the big immune system in your gut. When your gut is inflamed, the gut bacteria, the caloric absorption from these from the gut sources also vary, and then these calories, these bacteria determine how much of the food is absorbed, how much of the fat is absorbed, and also where this fat is distributed in your body. Most of them either in your abdominal girth is increased because of the fat distribution around your abdominal girth. So find out the reason for your fatty liver, and if it is your gut, change your gut. Find the reason why your gut is inflamed. Find the reason what you are feeding your gut that could be leading you to this fatty liver and the weight gain. And once you treat that, I'm sure your fatty liver or the reason for fatty liver will be addressed.
Yeah, quickly. And Mr. David, your questions have been answered a little while ago. I hope you've watched the entire episode. Otherwise, I request you to go back and watch the recording. Dr. Raghu, before I sign off or take leave from you, I would want you to tell us the alarm signs. What are the warning bells that your gut is not just home remedies, but it requires a consultation, medical attention?
Using the home remedies for the day-to-day, the gases, the bloating, the diarrheas, the constipation, the acid reflux and everything, fine. That's the way to go. But when you see certain alarm features, when you're using these medications for a long period of time and you still haven't noticed any relief in symptoms, most of the common alarm features that we see are persistent belly pain, persistent nausea and vomiting, weight loss, early satiety, loss of appetite, blood in your stool or black stool, your blood tests show abnormalities in your blood counts, you're anemic, you're losing weight. These are all alarm features that we need to look for. When you see any of these alarm features, do not go for home remedies or over-the-counter medication remedies. Seek some expert opinion with your family physician or your consultant physician. Get tested, rule out something serious that sometimes can be life-threatening rather than just continuing the home remedies.
Great. Thank you so much. That was really insightful. And now, before I take leave from you, I want top tips from you to keep my gut healthy.
Well, I think I've beaten around that throughout this 1 hour. When you don't want to seek expert opinion, you don't want to have any of these alarm features, you want to feel good on a regular basis, yes, the way to go, maintain a healthy lifestyle. Eat well, sleep well, control your stress and anxiety, exercise on a regular basis, eat the right food, find your trigger foods, avoid the trigger foods, maintain a healthy diet. That's the most important thing that I'm going to say. Avoid excessive processed foods, avoid excessive sugar intake, avoid the excessive carbonated beverages and the artificial sweeteners. That's the takeaway from the entire healthy 1 hour, I would say.
Great. Thank you so much, Dr. Raghu. And I know I would want to sit with you for all these other topics that we had mentioned earlier and talk about them in depth. And I'm sure that our audience will get benefit out of that conversation as well. See you soon. Hope to see you soon on the show again. Thank you.
Thank you so much for having me.
Thank you. And here I continue with the health quiz. 3 questions which are going to be asked on the show. You have to type the answers on the YouTube chat, and winners will be selected at the sole discretion of Apollo 24/7 team. And if I take your name to be the winner, then you will have to write back to us with all your contact details at marketing@apollo247.org. Please note the change. It's marketing@apollo247.org, and the gift vouchers will be shared with you. Here are the 3 questions for today. Question number 1 on the screen. This is a fill in the blanks question. Please fill in the blank. It starts with A and S. A N blank I B I blank T blank C S. What's the word? A से शुरू होता है, C से end होता है. Dash can kill both harmful and beneficial bacteria in your gut, leading to an imbalanced gut microbiome. What is it? Question number 2. Probiotics can help restore a healthy gut after a course of antibiotics. Is that true or false? Probiotics can help restore a healthy gut after a course of antibiotics. True or false? Question number 3. Stress can severely impact your gut health. Myth or fact? Is that a myth or fact? Stress can severely impact your gut health. Do type your answers. These are the 3 questions, and we are waiting for your answers in the YouTube chat. I'm waiting. Let me see who's all typing. Miss Vamsi, Nallamalli, and Ajay, Ganesh, all of you. And now here are the coupons that we want to give away. The first coupon that we are giving away today is AskDoc 150. You can consult top doctors direct from Apollo hospitals and get 150 rupees cash back on online doctor consultations when you use this coupon. Download Apollo 24/7 and use the code AskDoc 150. The next one that we are giving away today is First 3. The code is FIRST and numeral 3. You order medicines direct from Apollo, get 25% off on the online medicine orders. Get to our delivery in the other cities, but there are cities where you get instant medicine delivery as well under 19 minutes. Check if your city is in the instant delivery window, then that's a great benefit as well. Next one that we are giving away is exclusively for our Health Hour viewers. Use the code HH247 to get 199 off on online doctor consultations with Apollo doctors and up to 20% off on medicine orders. This is exclusively for our Health Hour viewers who have joined Apollo 24/7 and are using it for the first time. And you will not find this elsewhere. This is exclusively promoted only on the Health Hour show. So if you are a Health Hour viewer, here's something that you can use on Apollo 24/7. Remember the code HH247. And yes, can I also tell you that Apollo 24/7 is not just an app, but you can also access it on WhatsApp. Just like how you text and get your medicines, you can just call or text your medicines 09355247247. This is the number that you can avail to avail your healthcare services. And in the meanwhile, while a lot of you are typing the answers, let's see who the winners are. Today's winners are Vamsi Nallamalli, Ajay, and Falkreet Brar. I repeat, the winners for today are Vamsi Nallamalli, Ajay, and Falkreet Brar. Congratulations. Do write back to us at marketing@apollo247.org to claim your prizes and before Wednesday of every week. Thank you. And next week we are talking about headaches. How to fix your headache. What type is your headache? Why are you getting headache? Is it serious? Is it chronic? Is it vision? Is it anything else related to your brain? All these, a complete guide of headache. We are doing this on November 17th, 11 a.m. So let's talk about headaches and how to fix them. This is today's episode. Thank you all for joining us. Your questions make this really interesting. Keep asking your questions in the chat box and let's make it an interactive session. Thank you once again for joining us on this Sunday morning. Namaskar.